Hello, my name is Mariah. It's so nice to see you again. I'm super excited to jump into session, but I want to go over the informed consent form that you would have signed and just hit on a few things to make sure that you really understand what that informed consent means as far as the details in here and our work together. It is extremely foundational for our work together and our counseling relationship, so I want to really hit on it. First, I'm going to go over the 3 exceptions for confidentiality, which I'm sure maybe you have heard of before. The first being if you tell me that you are going to harm yourself or harm another person, it is my responsibility to break that confidentiality and take the steps to ensure safety for everyone involved. Second would be if I suspect abuse or neglect, whether that be the child, an elderly person, a vulnerable adult, whoever. With me being a mandated reporter, it is my responsibility to report that as well. And then last, if there's an instance where the court orders me or sends an order for me to testify or share records, I may have to do that. There are a few little ways around that to where I can protect as much information as possible while giving them the information that they need. So those are the basic 3. And while confidentiality has everything to do with what you share with me in this space, it also has to do with the fact that we are trying to create a safe place where you can speak openly and honestly about what you are feeling and what is weighing on you at that time. There are a few words that you may have read in there that you may not have understood. Privacy and privileged communication. Privacy just simply refers to your right to control your personal information, making sure that you are giving me permission to share with other people. The second one, privileged communication, is just a legal term. It is basically saying that in most legal situations, I am not going to be able to be forced to share information that is in our sessions or in our counseling history. Again, there are ways to not share your information and kind of give some details that they may need, but once again, I will not do that without your consent. I want to also hit on my rule kind of for giving out any information. If you're a doctor or a psychiatrist or any sort of person that is working with you wants information from me about our sessions or my diagnosis or treatment plans or anything like that, I require that you come in and sign a physical paper checking boxes of what I am allowed to share with that specific person, place, or whomever. I will not accept text, calls, or emails. Those are just not enough for me to protect myself or for you. So I just require that you come in and you sign a paper, handwritten, and that just protects both of us and keeps everything safe and secure. I kind of want to just wrap this up with just saying that I am for you. As far as this informed consent goes, I look at it as my main goal is to keep your story, your experiences, your thoughts, your feelings as confidential and safe as I can. I want this to be a safe place. I want you to feel safe and feel empowered and feel like you can share whatever you need to share. And having this informed consent in place allows that to happen and allows that work to kind of start to go and help us grow as we go through the things that are going on. So that is informed consent. If you have any questions, feel free to ask. Thank you.